Hello, I'm Dr.Aniketh Venkataram. I'm a cosmetic plastic surgeon. I'm currently based in Bangalore at 3 locations at the Venkat Center for Skin, ENT and Plastic Surgery in Vijayanagar and Bangalore, and at Ava Aesthetics in Bengaluru. Is Awake Liposuction safe? How painful is it? Well, Awake Liposuction means tumescent local anesthesia liposuction. It is different from general anesthesia in that the patient is not made unconscious. The patient is awake during the surgery. How it is done is that a few small holes are made with injection pricks. Then the anesthesia solution is given to the area where the liposuction has to be done. This process is done slowly so that the anesthesia has a nice time to work everywhere. Now this is extremely safe. It is safe in 2 ways. One, you're avoiding any possible risks of general anesthesia. Now, general anesthesia is very safe, but there are certain patients in whom it can be risky. If you have liver issues, if you have cardiac issues, then general anesthesia carries a little bit more risk compared to someone who doesn't have these issues. So in those people, local anesthesia is an option to consider. The other big advantage with doing local anesthesia liposuction is you are avoiding the very rare, very dangerous complications of liposuction. See, in liposuction, we are removing the fat that is just below the skin. The worst thing that can happen is if instead of staying in that layer, your cannula goes deep and damages some kind of internal organ. Now this is extremely rare, but every time it has happened under general anesthetic because the muscles are paralyzed during general anesthesia. In local anesthesia, the muscles are awake. So even if the cannula touches the muscle by mistake, it contracts and it doesn't let the cannula go inside. That's what makes this surgery so safe. The next question is it painful? Well, there's a little bit of pain in the beginning of the procedure, wherein you have to deal with a couple of injection pricks where the holes are made. After that, when you're administering the anesthesia, it's going to feel like there's something kind of moving around. There will be some discomfort. It's going to be lasting for around 10 minutes. After the anesthesia is given, there's not going to be any pain during the surgery. And in fact, the pain relief is going to last much longer after the surgery also compared to when done under general anesthesia. Because the local anesthesia medicine that we have given stays in the body for quite some time and gives you very good post-operative pain relief. At no point in this procedure is there going to be excruciating pain like, oh my God, what is this? That is not going to happen. Most of our patients are surprised by how comfortable they are and very importantly, how little pain they have after the surgery. Your recovery is very fast after local anesthesia. You literally walk out of the operating room and you go home the same day. There's no need for any admission or anything and you're extremely comfortable. Another aspect of safety is that it helps us to avoid some of the complications of liposuction. One thing that can happen after liposuction is a collection of fluid in the liposuctioned area called a seroma. For this reason, some doctors use drains to drain out that fluid. These are plastic tubes that come out. We don't have the need to do this because we do the dressing of the patient in the standing position after the surgery. We're able to make them stand immediately after the surgery and do the dressing in that position. This helps us squeeze all the fluid out and helps us avoid this complication, which is another added safety element of local anesthesia awake liposuction.